Hey everyone. The need that I'm aiming to address is the access to timely mental health care service for youth in Ontario. To address this aim, I'm proposing to create a youth specific video conferencing service as part of the new youth wellness hubs that have been created by CAMH. These wellness hubs, despite acting as fully integrated one stop shop for youth, they don't include remote access services, which I believe are a missing piece that would contribute greatly to improving mental health care service access for youth. This intervention will affect both the youth struggling to access mental health care, as well as the providers, be it psychiatrists, clinicians, social workers, etc., who are providing these services. By implementing this video conferencing service, I'm hoping to improve the wellness hubs by serving a number of groups of youth who might otherwise struggle to access their mental health care services. For example, it could help serve youth who don't live near any of the planned wellness hub locations and or lack the transportational means to get there. It could appeal to youth who suffer from anxiety, which may deter them from attending these hubs in person. It could be used to eliminate wait times and increase the frequency of follow-up appointments, thereby helping the hubs optimize their service delivery and serve greater numbers of patients. For youth who are concerned with the stigma of receiving mental health care, video conferencing can act as a discreet method of obtaining the care they need. And it can also be used for youth in correctional facilities as a form of treatment and rehabilitation. In addition to reaching these populations of youth who might not otherwise access the care they need, video conferencing can also help facilitate coordinated meetings between different healthcare providers with the patient as part of a collaborative effort. For example, a patient and their psychologist, social worker, and educator could all video conference together. In terms of funding, the video conferencing services are a very feasible implementation as part of the youth wellness hubs due to their low cost of implementation. A number of studies have shown that video conferencing healthcare services are associated with less direct and indirect costs as well as a greater return on investment than face-to-face appointments. Education and training will also be a required resource for both patients and healthcare providers, teaching them how to use the video conferencing platform. Finally, to implement video conferencing services with the existing face-to-face appointments of these wellness hubs, it's important to have sufficient IT infrastructure. By this I mean that these two services must be integrated into one platform to most effectively track a patient's progress as they access these services. There have been a number of other interventions that people have done to address the need of increasing healthcare access for youth struggling with mental health issues. One is the use of wellness hubs that I've mentioned, and they try to do this by offering youth-friendly one-stop shops. But despite the great promise of these initiatives, the addition of video conferencing services will further improve youth access by reaching the vulnerable populations of youth who may be missed, as I previously mentioned. As well, CAMH currently has a telepsychiatry program, but this does have several weaknesses. It does not specifically focus on youth. It offers just psychiatry and not other mental health care services, and it also suffers from the problem of very low utilization by both patients and psychiatrists. As a result, the video conferencing services as part of the youth wellness hubs that I propose will be a lot more effective. This intervention will succeed because video conferencing mental health services have been shown by the literature to be as effective as face-to-face appointments while being much more convenient to access. Underutilization is definitely a possible barrier, but this intervention will address this both from the perspective of the healthcare providers and the patients. For the healthcare providers, we will hope to introduce training for service providers working at the wellness hubs to increase their knowledge of and comfort with the platform. We will also present evidence-informed reasoning to explain the benefits of this service for patients in hopes this will persuade the providers to use it more. For patients, we want to create targeted awareness campaigns directed specifically at youth through both school education platforms as well as online mediums. Lastly, as previously mentioned, the video conferencing platform will be part of the youth wellness hubs, and therefore different healthcare service providers will be able to participate in discussions with the patients together. This is a novel concept and will provide an online alternative to the wellness hub's integrated approach to mental health care service.